The time to take action is now, because 40% of everybody in this country dies of heart disease. Maybe your first symptom is going to be sudden death. Hi, I'm Dr. Lee Kurisko. We got some really bad news just a few days ago, which is that a friend of ours had passed away suddenly without warning. He had been at home by himself, and he died, cardiac death. Was discovered by a family member. He had never had any cardiac warning symptoms. And the truth is that about half of heart disease, the first symptom is sudden death. Now, he was quite a good friend. I really liked him. And we had actually been working with him informally regarding some health issues, one of which was that he was approximately 150 pounds overweight. We told him all about the plant-based diet, and for a while there, he was really doing well with it, lost about 30 or 40 pounds, was feeling better, then started to backslide and regain some weight. So we were disappointed about that. But here's the message. He was very overweight. I looked up the statistics for what his life expectancy would be in that region of the country. And the average male has a life expectancy of 79.4 years. Now, according to Dr. Hahn's deal, you lose about a month of life for every pound you're overweight. So you're overweight 12 pounds, you're losing about a year of life. So I did the math, assuming that he was 150 pounds overweight. Even then, if he had lost that, he still probably wouldn't have been quite ideal, but much better off. If you do the math, his expected life expectancy was 66.9 years. I'm 66 years old, so was my friend. So that it actually works out perfectly. A take-home message is that if you have a serious risk factor for disease, like being overweight or diabetic or hypertensive, the time to take action is now, because 40% of everybody in this country dies of heart disease. Maybe your first symptom is going to be sudden death. Now, the interesting thing with a plant-based diet is that your risk of symptomatic heart disease goes down immediately. Literally within hours of switching to a plant-based diet, you improve the viscosity of your blood and decrease the propensity towards clotting, literally within hours. And, it reduces inflammation, improves blood flow. Plant-based diets can produce more nitric oxide, opening up blood vessels, improving collateral blood flow. So the effect is pretty much almost immediate. In the Esselstyn heart trial, where he put people on a strict whole food, low-fat, plant-based diet, the patients generally were having improvement in their symptoms within 2 to 3 weeks. And the males would notice that their potency was returning within that time frame, which is a sign that blood flow is improving. Now, if you look at the Esselstyn trial on heart disease, over a period of slightly less than 4 years with slightly less than 200 patients, the patients in the treatment group, there was only one cardiovascular event, which was a small stroke from which the patient recovered from, but the patient was not adhering to the diet. So you wonder if they really should have been counted as an event. Now, if you compare that to the control group, the event rate was literally 100 times higher. Now, the patients in the Esselstyn program were not healthy patients. They were people with really advanced heart disease, and then went, of the data I saw, went a period of 4 years with just that one small event from which the patient fully recovered, and then they got back on track, and they've been fine since. If you look at something like the PREDIMED trial, where they take healthy people, and I believe they observed them for about 4 years, and they were randomized to receiving olive oil or not. And, there was claimed to be some very fractional benefit to having olive oil included in the diet. But still, all the groups in that study actually had cardiac events. So they were taking healthy people that became less unhealthy as time went on, including olive oil in their diet. So the benefits were marginal. So there's no comparison between the effect of an Esselstyn type diet versus a looser diet with some olive oil in it. The point being is that the effect is profound with an Esselstyn type of diet. We just recently got back from one of Rip Esselstyn's retreats, and it was a nice refresher. We'd been there 3 years previously, and we had a conversation with a young woman that was pre-diabetic and wearing a glucose monitor. And within 3 days, eating the Rip Esselstyn's version of a PlantStrong diet, her blood sugars completely normalized. So it can be really quick that people start getting well. Anyways, my message is if you have any cardiovascular risk factors threatening your health, the time to take action is now. The sooner the better. I can't help but think that our friend's death was preventable if he had adhered a little more closely to a plant-based diet. So the experience of losing our friend just motivates us all the more to educate people. If you enjoyed this video, please like and subscribe and post a comment below. Thanks for watching.